I want to kind of give you all the state of the union for COVID cases and talk to you about what we can do about it. So I pulled this graph from the CDC website this morning. We are seeing nationally about 750,000 cases of COVID disease a day as a nation. Last week it was 500,000 a day. The week before that it was 350,000 a day. So when you look on the far right side of this graph, that is not the closing of the box on the outside of the graph. That's the tall vertical blue line on the far right that goes up to 1.4 million cases reported yesterday. And just to give you a feel, that last winter we had our surge. That's that little bump in January in the middle of the graph. And then Delta surge for number of new cases nationally is around September. So you can see that as far as the number of new cases, it's phenomenally more than it has been with any other surge nationally. Next slide. There's a lot of talk about how much of this is resulting in hospitalization or not. So this is the same graph I just showed you, but on top we are adding hospitalizations with the yellow line. And of course, these numbers are much lower than the case number. You can see that the hospitalizations in the January surge a year ago peaked out at about 17,000 hospitalizations or new admissions per day. The total number was a little bit lower in the Delta wave, although for us it was worse. And then when you look at now, the number of hospitalizations nationally, we are more than we've ever been before at about 20,000 hospitalizations and 20,000 admissions per day. Next slide. And then when you just look at our own community here in Tarrant County, the lower left bar graph shows you the number of new cases in Tarrant County each week. Each bar is a week. And that very tall line over to the right is not an error. That's the number of new cases of COVID that were documented in Tarrant County last week, significantly more in 1 week than we've ever had in 1 week before. Next slide. This is looking at hospital beds, and the disease has gone up exponentially, and the hospitalizations have not gone up exponentially, but they are rising, with the thought that Omicron may not be as pathogenic or severe and may not lead to as many hospitalizations. That we still know nationally there are more hospitalizations for COVID than there were in Delta, but maybe not as many as you would expect there to be. I think that's a good way to put that. So when you look at this graph, go ahead and go to the next slide. It tells you that at the current time, there are 1,182 people in a bed in Tarrant County hospitals that have COVID infection. Friday, it was 940. Monday, it was about 1,090. And this is, as of yesterday afternoon, it was 1,182. So the hospitalizations are on the rise with the Omicron variant. Scientifically, there is a lot of argument about whether Omicron is milder or not. And it's not clear. Some people think that in the wave of Omicron, it's possible that our most vulnerable patients have died already from COVID if they were going to. And those of us that are left, the population that's left is more vaccinated and has already survived this long. And it's hard to really put your finger on that and wrap your arms around that. It's not clear that this is less severe, but maybe it's less severe. We do know that we're still full of COVID here and still dealing with it, especially with staff shortages, because all of us are getting sick too. And so let's go to the next slide. Here is what we are looking at here at Cook. Again, this looks exactly like the CDC graph. If you look over there to the right, you can see that the number of positive cases within the full inpatient outpatient system here was up to about 700 cases per day. More positive tests, more percent positivity than we had in either of the other two waves. Next slide. So the question is, how are we ever going to get through all of this? And I want to give you all some of the positive things to know about this. Our toolbox is really very different than it was a year ago. As a system, we are much more likely to be vaccinated, which is helping to keep us safer. We know that these vaccines are very effective at decreasing your risk of landing in the hospital and death, even though a lot of us are going to get a mild infection. Remember that when you have a vaccine, one thing you can ask the vaccine to do is prevent any case of illness. For things like polio, that is paramount and critically important. When you have an illness that can have a milder presentation and you have vaccines for that, we are now asking, is the most important thing that the vaccines prevent every single infection? Or is it the most important thing that the vaccines keep us from getting sick enough to land in the hospital or die? So we know that the vaccines are excellent at keeping us out of the hospital and keeping us from dying of COVID. We know that in the children in our hospital here, very rarely is there a hospitalized patient sick with COVID disease who's fully vaccinated. That's very rare. That is borne out all over the entire nation. The vaccinated people are very unlikely to be hospitalized, but the vaccine does not fully prevent just the infection. Just the mild infection can happen as well. We hope to avoid that, because if you get the mild infection, you still have to be out of work for 5 days, and you can still hug a relative that's on chemotherapy who may not do very well with this. The next question is, how will we get through this with our outpatients? There are a ton more tools in our toolbox to keep our outpatients from having to be admitted to the hospital and to keep them from dying. We know that sotrovimab is one of the monoclonal antibodies available. It's the only one that neutralizes or kills the Omicron variant. So for outpatients at high risk of progression to severe disease, we're trying to give them this monoclonal sotrovimab. The problem is we don't have any, and neither does the State Infusion Center. And for that matter, not very many other people in the country. It's in terribly short supply. A second option for outpatients to help keep them out of the hospital that's brand new in the last month is Paxlovid. Paxlovid is the oral antiviral medication taken twice a day for 5 days. When you look at the scientific data, the monoclonal antibody infusion is about as effective, about equal to children who get Paxlovid as far as preventing hospitalization. The same is true for Paxlovid. There is not very much of it nationally to be found. We are getting a few doses here, hopefully later this week. The Paxlovid is only used for ages 12 years and older. A third option is molnupiravir, but this is only for ages 18 and over, so we probably won't be using as much of that here for our outpatients to keep them out of the hospital. A final option that's not very appealing is to give people remdesivir as an outpatient if they're 12 years of age and over. We are bound by EUA rules on all of these things. Remdesivir can be given once a day through an IV to an outpatient for 3 days in a row to help prevent them from having to go to the hospital. We have not done that for our outpatients yet because logistically it is very different. It's very difficult to put an IV in 3 days in a row and to have a place to bring them back to when they have active COVID infection. Next slide. What are we doing about our inpatients? We know that all of these treatments listed here are beneficial to help our inpatients stay out of the ICU and to help prevent death. Dexamethasone decreases the inflammation in their lungs. Remdesivir, when used for these patients, kills the virus directly. Tocilizumab is a third drug that we're using that gives us much stronger immune suppression to decrease inflammation in those who have a really excessive inflammatory response. Those are the things that we are using on a regular basis here. We have so much more at our disposal now than we did a year ago to help keep kids healthier, and we're using everything that's listed here. Some of the other things we use are Lovenox. People who have COVID infection are prone to getting blood clots just from the virus infection itself. Much higher incidence of stroke and blood clots in adults particularly, but also teenagers. So we put people on Lovenox when they get here if they're at risk for a clot. We're also using IVIG and anakinra for children who develop the inflammatory syndrome. And these two drugs have been remarkable in really making kids feel better within about 24 hours. That is the information that I wanted to give you all. Stan, do you want me to go through the chat and answer questions, or do you want to do that?
No, I was going to actually thank you for recognizing that. There's a couple of questions and we have a few minutes. If you could respond to them if it's appropriate.
There are questions about a lot of false negative tests with Omicron. Is that true? The formal answer is that rapid tests that are listed as an approved test by the FDA for emergency use should pick up Omicron the same that they did with Delta. Our lab here, our PCR lab here, will pick up Omicron the same as it did with Delta. At saying that to you, I hear what you're hearing. I have had lots of friends that are negative, and then positive on these at-home rapid tests. And I don't know what to tell you about that. I know that the ones we're using for our system here are approved and should be able to pick up Omicron in the studies that have been done so far.
Okay.
And then, is there any tracking of hospitalizations due to COVID versus hospitalizations for other reasons and incidentally COVID positive because every admission is getting tested? For sure, that is a great question to ask. And what you're saying is, how many people are in the hospital with COVID versus how many people are in the hospital for COVID infection? I do not have the answer for you for the number of kids that are here. I just counted. We have in the mid 50s of children in the hospital here that have a positive COVID test. And I do not know what percentage of those are with COVID versus for COVID. I can tell you there are plenty of children here with a positive COVID test who have something else. The thing that is important to remember about that is we have to keep the staff safe from getting COVID from the incidentally admitted children who are here with COVID. That still leaves us with all of the infection prevention for the staff here. Let's see, the next question. I think that's it.
Now there's one about, will we have to get vaccinated again this year?
Oh, I'm sorry, I missed that. Yes, I don't know if we're going to have to get vaccinated again this year, and I don't know if it's an annual shot. It's important to remember that with influenza, we get an annual shot because there is genomic drift and shift with that particular virus, and it has to be a new shot every year. So far, the vaccines that we have gotten have worked for Alpha, Beta, Delta, Omicron. They're not as effective for Omicron, but if you get a vaccine booster, you're well protected to stay out of the hospital with Omicron. So the jury is out about when or if the next shot will be.
Outstanding. And there's a lot of great comments about your presentation, Dr. Whitworth, about how easy it is to understand. And even one says they wish you could present to the whole nation, the whole nation could hear you. One comment that you rock, and we agree, you're very gifted. And Amanda writes a comment, she thanks you, but she also asks for everybody to have patience as they're using the drive-through. She's thanking everybody for using the drive-through. But as you've seen from the numbers, we're very busy, and we encourage you, if you're coming in with your child for pre-op procedure, or if you're coming in to be tested, that you have a little patience with the drive-through team.